Aloha.
Aloha. Mahalo for having us.
Aloha, brothers.
Isn't it nice being on the beach in Hawaii?
Thanks
yeah.
for letting me borrow this hat, by the way. It's
Yeah.
really helping with the sun.
You know what, if you don't have a bathing suit, all you need is some dish towels. Okay, so qualitative studies. This was my first time reading qualitative studies.
Hard to find.
Me as well.
Yeah, they're hard to find.
Yeah,
Hard
definitely
to find
difficult
new
to find.
ones.
Oh, yeah. Up to date
In
ones on topic.
English, it seems like other countries are good at like writing them, but not us.
Anya, Iran is on it with back pain and qualitative studies.
Now,
Unfortunately, only the abstracts are in English.
that would be an interesting study to do to see if Iran has lower rates of back pain because they've studied it more.
Study
Oh
7
my
and
God.
Qualitatively.
Qualitatively.
Specifically Iran though.
Yeah.
Research in action. Okay, so let's talk about what we did find.
Okay. Should we go each person introduce theirs and then we can open it up?
Yeah, let's just converse it. Yes, someone's gotta start though. You go. No, you go.
Okay, I'll talk about mine. Mine's called Risk Perception of Non-Specific Low Back Pain Among Nurses, a Qualitative Approach, which is funny because also Riley and Julie found this article, so it was a popular article. But it kind of talks about how, so what they did is they had interviewers interview 30 nurses, 20 women, 10 men, 19 of them who had back pain and then the rest didn't have back pain. And they ask questions such as, how likely do you think it is to get a backache while performing your tasks, and in what situations are you likely to get back pain? And then there was a lot of interesting responses, things that I hadn't even thought about before, such as like the interesting ones. It can affect your family dynamic because if you're like really sore at the end of the day, you're gonna wanna just go home and like lay down.
Oh
You're
wait,
not
oh,
gonna-
I saw this one too.
Yeah.
Okay, so
Yeah.
the mom was like, I
Yeah.
can't take care of my kids.
Right.
Yeah.
Or like there was one, it was really interesting how they talked about it because I don't know if it's like a cultural thing in Iran, but it was like, they talked about the financial aspect, but
And it was
only in regards
it was
to
more
men. Yeah, only
I
men.
thought that was weird.
So it's like saying how if you have back pain, you're more likely to retire earlier,
Right.
and then also you're gonna miss more days of work. So then that puts a strain on your family financially if you're unable to bring in as much money. So a couple of aspects like that I didn't really look into too much, or hadn't thought about too much beforehand, but
Right.
now that I've been made aware of this, it's like, yeah, that totally makes sense. I can totally see that. And there was another one that was talking about how it can just affect your overall affect and mood towards your patients. So like if you're sore or like your back hurts, you might be a little less empathetic that day, or maybe show your patient a little bit less respect because you're more concerned about, oh, I hurt. Like I
Yeah.
don't have time to think about how this other person's not feeling good.
I feel like I read a quote in that one about this one nurse that said like, and then we can make medication errors
Yeah,
as well.
yeah, I did have that in here.
So like she was just real clear about it. That's something that I was surprised
It's
that they got like real honest
Yeah,
answers.
she said something along the lines, if I paraphrased it, that lower back pain can cause a lack of concentration and therefore errors. So
Okay,
like,
yeah.
same thing, you're thinking about how my back hurts and you're less focused on your however many writes and your rejects and all that stuff.
Yeah, totally see it.
Yeah, a lot of cool stuff in this one.
brought some new perspectives and then re-emphasized what we're doing.
How many people did they,
30.
30.
Average age was
Qualitative study.
34 plus or minus
But the
5.5.
The good thing was that there were people from all different shifts, so it
Yeah.
wasn't just
Oh, okay.
limited to day shifts.
And a lot of different backgrounds, like different departments. It was a pretty diverse group, for sure.
I think there was one study, it might have been like the one that was the abstract that sounded cool, the whole thing was written in Arabic,
Yeah.
where it was only like BSN and MSN
Yeah.
nurses.
It was that.
It was gonna be such a good one.
Well, this one was only bachelor level
Okay,
nurses.
okay. I feel like for some reason that's important compared to the associate's level nurses. Coming into Hawaii.
Do you want to come say hi?
back pain, but I'm not even sure that's true.
More education means less back pain?
Yeah.
Yeah.
In our past one, we found that people that have a BSN actually have more back pain.
Oh, no.
I wonder about like a doctor level, though.
Yeah, that's all.
That's a good question.
I think it'd be more like, well, because you can have a higher level goes into more of the managerial aspects, and then you're not really like physically lifting the patients and doing that, you're more overseeing. So I could see like less injuries in that aspect.
Yeah, totally. I can see that too.
Okay, who wants to go next? Or we just keep talking? All right, yeah.
Do it.
Okay, so, mine was specifically listening to the body and talking to myself, so kind of like a cool metaphor, kind of catchy title.
Wow.
So this was an older article, it was published in 2009, and the method used, it was around semi-structured interviews, and they got it based off a response on an article, so it was just voluntarily, but they weren't specific on the sample size, just that it was based off that. And it said it was approved by the Regional Ethics Committee, so it actually had that in there. It was the first time I saw that. And they found 4 themes, unpredictably of the pain, need for vigilance, and externalization, objectification of the body, and alteration to sense of self.
What do they mean by alteration, sense of self?
I don't know.
Could be like how you perceive yourself,
Yeah,
like
just-
your self-worth maybe.
Yeah, because if you're in pain, you're just.
Yeah.
I don't feel as powerful.
I know,
Right.
Yeah,
as
You can't
useful now.
fulfill your role
Right.
as fully.
Totally.
Yeah, and they actually had a research assistant doing the interview, and then they had someone supervise it as well. And the people that were able to do it, they had to have chronic lower back pain, but that was limited to 12 weeks, rather here in the nursing field, chronic isn't defined until 6 months. So it was a shorter duration, which I thought was
Such a
interesting.
long time to be in pain.
Right.
Yeah.
Yeah.
Okay.
Yeah. It's cool.
Alright, I could go. Mine was titled, I was a little more abstract too. So mine was titled Perception of Nurse Managers about the Functionally Readapted Worker. And this was in 2018, and what this study does, it's in Brazil, like southern Brazil. And what this study focused on was more of, it was questioning the nurse managers about their nurses who've been through kind of like physical and mental trauma and were then readapted and kind of like put back in the workplace. So it's kind of like asking the managers, like, how do you perceive these workers coming back onto shift? You know, like, do you trust them, et cetera, et cetera? Because it kind of stated like, you know, they can almost get like bullied by their coworkers too. If you have someone coming on, it's like, well, I don't really trust them to like work with patients anymore. You know, if they had a back injury, it's like, can they really lift? Like, what if they re-injure themselves? And I kind of brought up this whole like interesting mindset because we're doing the preventative, but it's like, well, what about the people who already had these injuries? And it's like, you know, you're protected under certain laws it mentioned, just as a work-related injury. Then it's like, well, you know, what about when you're technically all better and you can come back to work?
Yeah, because you may still be feeling like lingering effects.
Yeah.
You're like good enough to work, but maybe not all the way.
Either that, and then also just how other people perceive you now.
Yeah.
And that's all changed. So then it kind of got into that aspect, which I thought was pretty fascinating. And then basically like kind of like quickly concluded, kind of brought up that, and we could maybe even incorporate this into our thing, it's important to make sure that these people who have been readapted, you want to maintain their self-esteem, identity, which is a big one, kind of mentioned if you're not feeling 100%, autonomy, similar, and then the feeling socially included.
Yeah.
It's pretty interesting.
Did it say anything about the nurse managers, and I only skimmed it, I didn't read it, so I don't know if they did or not. But like, I remember them saying like, well, you're kind of damned if you do, damned if you don't, like, put them on the schedule, so you need somebody to
Yes,
fill
that
in
was,
the
that was
part.
the biggest thing, cause it went over the whole perception, and so I read all the nurse managers' responses that they had listed, and the, common theme that I noticed was all of them kind of mentioned, we're short-staffed, we have to work with what we got.
That ties in really well to an aspect in my article that talked about how when nurses are short-staffed or departments are short-staffed, the nurses have to work that much harder to kind of pick up the slack. And that leads to like less time to be able to sit down and chart, less time to be able to relax and eat lunch. So you're just on your feet all day long, almost running around the hospital, and that can contribute to that low back pain, that short-staffing.
Ruthless cycle.
So how many managers were they able to,
They got 14, 11 were women and 3 were men.
did they say like when they knew it was time to stop asking more managers? Okay, so like that's something in mind, and like that came up in a few articles, it's like, so we use this like snowball method, like we're like with mine, they only got 17 people to talk.
Mm-hmm.
But they started seeing repeats in the themes and no new information being contributed to the themes, so that's when they knew they could stop.
Okay.
So like, that was one thing where with like the qualitative stuff, it's like, we need to get as many numbers as possible.
But that's
And
not
with-
necessarily.
And with
Yeah.
these, it was like, we need to get as many perspectives
Mm-hmm.
that are unique. And then once that starts to slow down, we don't need to talk to anybody else, because we
Yeah.
have the majority of unique perspectives, or all of the unique perspectives.
That wasn't something
I
I
got
thought
you.
about before.
I had never thought about that until I was
that
like,
Yeah, I don't think my article included that, but I could see the similarities in some of the themes. Some of the themes I will have to say, like some of the managers recording, I was reading them and I'm like, oh, you must be a really good manager, because they were just like completely positive about like rehabilitating and making sure their nurses are 100% getting back in the workplace and making sure they're comfortable. I'm like, it's a good manager.
yeah,
I
yeah,
only read your quote, but I'm sure you're a good manager.
Yeah, that point that you brought up, Rachel, ties in really well to just like the difference between quantitative and qualitative is the cool things about these articles that we're seeing is it's so much more centered on how this low back pain is making the people feel and how it's affecting them like psychologically, instead of just being like a number in the study. It's like they really dive deep with each person and get
Yeah,
some meaningful information.
super deep,
So it's cool to have both perspectives.
yeah.
Definitely. Well, mine is called Healthcare Managers' Perspectives on the Sources of Evidence in Evidence-Based Hospital Management. And it's a qualitative study done in Iran. And this kind of
Popular place.
I'm telling
I had to
you.
mention that.
Place to go,
I
you
had to
wanna be a
mention that.
researcher.
Exactly.
Yeah.
And so basically, this is tying into how we are further going to implement our evidence-based practice from our QI work plan. And so the qualitative study was taking the perspectives and the attitudes of evidence-based research of hospital management. And there were 48 interviews and 4 focus group discussions, 19 focus group discussions within that. There were 19 females and 29 males. The majority of them had PhDs, and the average work experience as a healthcare manager was about 6 years, a little less than that. And so it was essentially just asking certain questions and getting the conversation going in these interviews and these focus groups about, like I said, perspectives on evidence-based practice, their sources, and what was expected is kind of the result that happened, is like the vast majority are implementing evidence-based practices.
But it was like 95%, right?
Let me see.
I think it was like 95% people were like, yeah, that's good. I was wondering, what did the other 5% think would be good?
That's a good question.
Because there were a lot of questions, so,
No one, it's practice.
I just read the
Yeah.
abstract on it, I didn't like go deep on that one.
It's cool that yours actually has the questions that they ask.
Yeah,
Like,
I-
like a few
Because
of
a
them.
lot of them are kind of vague.
Yeah.
What kind of questions did they ask?
so a few of the ones that I have here are, what are the manager's perspectives towards evidence-based hospital management? What are the types of sources in evidence of the process in evidence-based decision-making? What are the manager's perspectives towards the applicability of the sources of evidence? Yeah, so you're right. Towards the question, would you like healthcare management to be evidence-based? 95.83% said, which,
So what are the 4%,
Yeah.
like, what are they,
What are they
should be
for?
based
Yeah,
on bribes and
Yeah.
money and?
Yeah, that's a good
Their
question.
own,
Maybe
stuck in
they
the
just
ways
didn't
one
understand
person.
the question.
I would like an
Yeah.
alternative,
Sometimes that
because
happens.
from what I've read in the article, it doesn't give, like, there are specific responses, but it doesn't address.
Yeah. I mean, I know money's a
So
big
it's like
deal.
4%.
Right.
Well, that 95% is pretty good for us to know, like, that if we've got a good evidence-based study, like, hopefully the manager would be on our side.
Yeah, people will be on
Approving it.
board.
Yeah.
As long as we can show that the employer's place is the best place to address back pain. And that is what my article talks
Wow,
about.
what a segue.
Right, well,
So 46 out of the 48 participants did believe that healthcare management should be evidence-based and that they have a positive attitude.
So it's the two people that we need to worry
Those
about.
people that we didn't get direct quotes from,
Yeah.
unfortunately.
That's too
That would
bad.
be interesting.
So, this article, perceptions of health professionals toward the management of back pain in the context of work, a qualitative study, frames back pain and patients and going back to work from the perspective of general practitioners and physical therapists. Now, our plan is to have a physical therapist involved in training. And that's why I felt like this was kind of a useful article, but also some themes that this article identified was physical therapists and general practitioners feeling that although they provide advice on adaptations in the workplace to the patients, the response of the employer to that advice is crucial in the patient actually being able to go back to work and do their job without re-injury. So just having somebody go see a doctor about their back pain isn't enough to address the back pain, the fears around going back to work that the patient has, and the fact that of preventing re-injury. So now we've got that layer of doctors and physical therapists are saying, like, we can provide that advice, but it's not our job to make a safe work environment for these people. It's the employer's place to do that,
Yeah, that makes sense.
Yeah.
right?
It'd be like outside of their scope almost.
Well, so this was based in England or Great Britain, where the general practitioner is required by law to be the person to say if somebody can go back to work or not. They have to have a note saying that they're either not allowed to go to work or that they have to go back to work. But the general practitioners don't like that because they don't feel like that's in their scope of practice.
Right.
Because it's almost because so all of those general practitioners in England are employed by the government there. So while they're government officials, they say that this is one of the major themes of this as well, was that they were the patient's advocate. And so they wanted to make sure that the patient was safe and didn't have re-injury, but they also were responsible for issuing wellness certificates that got people off of disability and got them back to work. And in in that context, they are part of the government trying to get people like off the dole.
Yeah,
So they had this conflict of interest,
Yeah,
but
it's like
they
a
were like,
catch-22.
but we were trained
Yeah.
as doctors and we're patient advocates, and that should be our number one goal, but now suddenly and it's only the general practitioners that have that. The physical therapists, who are actually way better at talking to the patients about like their psychosocial issues and their workplace environment, they don't issue those wellness ready to work certificates. Only general practitioners do.
Because
So-
even when we get a surgery here or something, it's always, oh, your doctor has to say this.
Yeah.
Where, you know, it's the PT that's really working with you. It's
Right.
all of that.
Right. So like the things that it had was like so the GPs and the physical therapists approaches to evaluating patients' problems were different. Physical therapists were going a little bit deeper and asking about their workplace, asking about their, like, as I said, their psychosocial issues as well.
that makes sense just in the fact that, just from like an anecdotal perspective, every time I've been in physical therapy, you're spending like at least 15-20 minutes with the physical therapist just chatting. So
Oh,
they
yeah.
may have
Oh,
more
yeah.
time
Just-
also
Okay.
to be able to speak on
So,
that.
and there's a confounding factor with this one. So there were 11 general practitioners and 6 physical therapists. And then, there's something, I don't know if I'm gonna be able to find it super fast, but, of the general practitioners, oh, here we go. The general practitioners, 6 were male and 5 were female. Of the physical therapists, 0 were male and all were female. So is it that the females, like, and this was not addressed, were they better able to kind of like feel comfortable diving into asking some of those questions? It might have been
Could be,
like multifactorial, you know?
Yeah,
And this is
That needs a
England,
study
and a
all
lot
on
of
its
guys
own.
don't like to talk about their feelings or anything, but women might be more likely to do that, so, you know, it could be that too.
yeah.
And it's also just a stereotype that comes with men. It's like, oh, you're tough. You can be.
Mhm.
We don't have feelings.
No.
Well, and this is great, this is great for them where they don't talk about their
Yeah.
feelings as much as here,
That's
you
it.
know? It's like China and Great Britain, those things don't come up as much. So, where are we at with time? Like, how are we doing?
I didn't know that was a
Really great
British thing.
perspective to
though.
bring up.
Yeah.
We got 7 minutes left.
We have 7 minutes. I felt like we had, like, we did a lot of rich, deep diving. Are there other
did.
things we
Go
should
like that.
ask about?
So, yeah.
Or is it time to go surfing?
I have another thing I could bring up.
Okay,
Um,
let me adjust my dish towels.
Okay.
Dress. Okay. Okay.
I just
So,
think golf burping.
It's supposed to look a little bit like a moo-moo, but.
so this is something that I can personally relate to a lot, being in the clinical setting, but maybe not necessarily for lower back pain, but it talks about how lower back pain can cause anxiety in nurses because they feel like they're less able to perform their job as well as they would be if they didn't have the pain. So it makes them anxious that they're not gonna be able to do as good of a job, which, like, there's times in the clinical setting where I get anxious and I'm just on like red alert, like even my clinical professor would point out like, man, your face is really red, like every time.
Your
So,
blood pressure is.
yeah,
Like, let's take your
so like I could definitely see how that would negatively affect a nurse, and that would maybe cause more burnout, it would cause degradation of just your overall health over time, being that stressed and anxious all the time. So it's just another kind of interesting factor.
Yeah, nurses do not need any extra unnecessary stressors in their lives.
Right, totally.
And, back pain's debilitating,
Mhm.
making it so bad you can't even move. I've experienced that plenty of times.
And I feel like a lot of nurses feel like it's their duty to show up to work. Maybe not all, but many feel like they have to go even if they're sick or they're not feeling good, and that can compound the issue. Like, my sister's a nurse and she participated in I'm blanking on the word, like a lockout or a strike or something. But a lot of them felt a lot of the nurses who participated in that felt like a huge conflict of interest because they're kind of leaving their patients.
Yeah,
You know,
that's
it's almost
tough.
like you're abandoning your
Yeah, you
patients,
have
so.
like the loyalty to your patients and then your fellow nurses.
Yeah.
Yeah,
Yeah, so then if you've got that pain, plus, we've all been kind of conditioned in a way to work while feeling uncomfortable.
Yeah,
Like we're supposed to
totally.
just power through
Just suck
it.
it up, yeah.
Just
Yeah.
after 8 hours, it's like, oh, my feet hurt, my back hurts.
Yeah.
I'm gonna keep going.
Yeah, like it's just, yeah,
And especially, at least in this cohort, from what we've seen, is a lot of people are type A personalities who have the fortitude to go after nursing, so people aren't willing to like say, oh, I can't do it, I don't feel good, I don't wanna go. People are saying, say, I can do this, I'm gonna power through it. And that can have that compounding effect on making the back pain worse, and then leading to all these other issues.
I also feel that even though we're supposed to come up with non-pharmacological interventions for things, that usually we all want to just go see the doctor, get a pill to fix it, especially when we're working.
Yeah, we don't have time
You
to go
know.
to physical therapy.
Right, but also, even though we learn as nurses that those are the interventions that we're supposed to be promoting, those are the ones that we get tested on the most. You know, like what's the most stressful tests are the pharmacology tests.
Yeah,
And knowing the actions of the drugs are so very important, and what is the most like revered person in the hospital prescribed for the most part? Medicine. You know, so it's like, it's this really weird dynamic of the things that would probably provide the best relief, like physical therapy, foundation training, maybe going back to the 8-hour workday instead of 2 12s, but money's
Self-care.
there. Yeah, self-care, like the
Self-care.
things that would actually make everybody's job better are the things that we don't do, and
Yeah.
that's sad.